Hi, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today we are talking to Roberto Ascione, the CEO of Healthware Group and the chairman of the Frontiers Health Conference. Actually, here at Frontiers, I got to catch up with him where he has launched the book that he has recently published. It's called The Future of Health. Roberto, congratulations on writing a book.
Thank you so much, Jessica.
I want to hear all about this. And so tell us, first of all, what is this about? Because I think anybody who's probably watching my show is like, hey, I'm a part of the future of health, or at least I hope to be. So talk to me about what the book is about.
The book is about the future of health, and it's basically a attempt, not complete, at a certain, kind of time point, an attempt to connect dots. Not for the experts, although some experts told me it's cool, I read anyway, but it's more for anyone, whether it's consumers, patients, doctors, that want to make sense of this. Hearing about digital health, digital therapeutics, telehealth, remote monitoring, all those terminologies that we have been using since years. And this book is about a vision for this future of health through the adoption of digital health at scale.
Okay, this is exciting because I used to work for a blues plan, and at the time, this was years ago, there was a lot of educating I had to do about telehealth and about digital health. What is this? And even still now, some people are, what is a digital therapeutic? How is this different? So talk to me a little bit, and I love how you said this book is really for everybody. You don't have to be an expert. So tell me a little bit about, how when you put this together and when you wrote it, you made sure to include the audience that might not be the obvious audience for this kind of a book.
Well, I mean, the whole idea was to, book is divided in two sections. Probably that's worth explaining. And the first one basically is about examples and definitions with practical examples about few areas of what we collectively call digital health. So we start with the devices, the IoT health, and the digital medicines, and the role of data science and AI. And this basically goes through a number of applications that people can relate to. They are available eventually. And also there are friends that have chimed in the book that I invited to do so. There's a second session that is more about the perspectives. So if that's the today and the future of certain things that are emerging, what about when we scale these things, when we foster adoption, and we can really integrate this in the care pathways and in the policies and so on and so forth. So the second part is more about this vision for the future of health.
All right, let's dig into this vision. So can you share with us, no spoiler alert here maybe, can you share with us some of the elements of the vision for the future of health that you have as a result of putting this together?
Yeah, what I've tried to do is to try to describe the situation of a healthcare that will be a lot more data-driven, with a huge focus on prevention, with the usage of platforms connected with the devices, but also personal consumer devices, creating the ability to understand where we are transitioning from the state of health to a state of disease, but much sooner that the symptoms onset. And after that, what the disconnected care might unfold, and what will be these new modalities, new class of treatments, aka digital therapeutics in different ways, might have an impact on the way we program our therapies. And of course, there's a deep dive on telehealth. And so it presents this vision for essentially a shift from curing diseases to taking care of people, trying to keep all of us out of troubles. And when that happens, have a rationalized use of this wealth of technology based on the data collected eventually during our lifetime or a period of time, and deploy more precise interventions afterwards. And all of this to allow for a greater and better access, equalize more the access to the highest standards of care while keeping this sustainable. So these are key elements of that. And there's a human reflection that as a fil rouge through the book, which is to say, are these technologies creating a technomedicine? I don't think so. The idea is that this technology will humanize care a lot more by reducing frictions, giving back time to physicians, to better focus on patients. So all those kind of positives that the digitalization well done and at scale can really bring, and we have seen in other industries already since years, or is about time that that happens in healthcare too.
I love that you have pulled that together for the rest of us to use as we are out there fighting the good fight for the integration of health tech. I want to know, as you're looking at this, when you were putting the book together, and I understand that this is an updated version of a book that you wrote in Italian years ago. You've been in this space for a very long time. How close are we to this future that you're articulating here in this book?
Much closer than before and ever. This has been all accelerating. We have a ton of technology available. We have a lot of tools to connect dots. First policies kind of getting there, not everywhere in the world, but in different chunks. We are really getting there and doing better and better. So I think now we are out of phase one, the pioneering phase, the proof of concepts, is this a thing? And we are now beginning phase two, which is to say, how we make it happen, how we scale this, how we really deliver this to patients. That's why, as I mentioned before, access, I believe, is important. Doctors, having them in the know, knowledgeable, having an understanding of the solutions, convey the solutions in a way that they can become part of their toolbox. Policymakers starting to create the framework. It's all important to really pave the way for this phase two, which to me is basically scaling with judgment about the adoption of these solutions.
Is that the intention for the book? Is that why you wrote it, to help pave the way, to make it a little bit easier, or do you have a different reason?
I think that's essentially the reason, the rational reason, I would say. Also because having started many
What's the irrational reason?
Or the emotional reason.
Got it.
So the rational reason is that given we started many, many years ago, we had this need as a company to really explain what we were aspiring to do.
Sure.
And so we trained ourselves through the conferences, through other ways, to really contribute to the ecosystem. And this book goes in that direction. That's the rational part.
Okay.
The emotional part is the need to crystallize, and that was behind the first book and even more behind this edition, which really, was born during the pandemic, to really crystallize years, not only by myself, but also by my team and many friends, of thoughts and ideas in something that could be, kind of stable, static, with the endurable, like a book. Paper book, which will be updated, etc. But that you can really, digital health needs to go out of the lab and really to everyone. And we felt that this was a good idea. That time will tell if that was a good idea indeed.
All right, shout out some of the contributors you have in this book, because like you said at the beginning, this is not only your perspective, you asked some friends to contribute as well. So tell me a little bit about some of the people that you asked to participate, maybe give us a sense of why. I'd love to hear that. And you always talk about the ecosystem, and so I think that is probably part of the importance here in bringing some of these other voices into play.
Yeah, absolutely. Jeff Dutch is from OneDrop, Monique Levy from Wobot Health, Tony Australia from Teleosa, and of course, I don't want to make a lot more. I don't want to leave anyone out, so I'll mention a few. These are all people that we have been growing up together as a community. We were very few in the beginning, and of course you were there, and then we grew as a global movement, and now it's an industry, essentially in its infancy, but it's an industry. So the idea was cherry pick several perspectives, add to this, so that to have a more kind of collective voice, on top, of course, mine, that is just one angle, but we have multiple angles. So that was basically the rationale, besides the pleasure to have, friends contributing to this effort.
I love it. It is packed. Like I've read through this, and it is like everybody is in this, and every type of digital health, virtual care technology is in there. I love it. Last question for you about the book before I move on, but I wanted to know, how do you hope this book will be used? Like within the industry or even among patients, like you said, it's written in a language that anybody can understand. So how do you hope it will be used?
Well, I mean, I can tell you what happened with the first book that was in Italian only, and my first and only thing in Italian, which I did for, like a milestone in my career, and I decided to do that. It was used, and I still getting a lot of messages. People change type of study they're doing. Incorporate projects have been approved because of, something that was coming out of the book. So it's been an enabler. So if I have a wish for this book as it travels the world in is totally updated, almost a new book in English, is that it will function as an enabler. Enabler of projects, ideas, funding, maybe in also some, more traditional stakeholders would be, with help to really make sense of this. Because of course there's a lot of hype, and I think it's also important that we scale all of this with judgment.
All right. The book is an enabler. Healthware Group, to me, is a facilitator, a connector, so many things. I mean, you have Frontiers Health and you have all the different lines of business. You guys are co-developing digital therapeutics with pharma companies. You guys are working on different digital health projects with a number of other clients. Tell me what else is going on at Healthware real quick.
Essentially, Healthware is in its maturity now, is scaling nicely, and team is great in multiple countries. Essentially, that's exactly what we do. We have two sides. One helps to shape the market, prepare the market, commercialize all sort of interventions, including digital health and digital therapeutics, as they, of course, come to fruition. The other side helps and partners to co-develop technologies, whether it's telehealth, digital medicine, digital therapeutics, and this is happening with big corporations, with nascent startups, and sometimes with both of them at the same time. So we couldn't be more excited because the vision that we had for this company is now really unfolding and scaling, and so that's really exciting.
Awesome. Well, Roberto, thank you so much for stopping by, chatting with me in detail about the book. I did get it signed, for those who might be wondering. We'll have to post what he wrote to me. It's a very special message. But thank you so much for stopping by. Pleasure to speak with you as always.
Thank you so much, Jess.
All right. I'm Jessica DeMassa here with Roberto Ascione, the CEO of Healthware Group, the chairman of Frontiers Health, and the author of this book, Future of Health. I'm Jessica DeMassa. Find more interviews with the who's who of health tech over there on my YouTube channel, youtube.com/WTF Health. Take care, guys.